Hello, my name is Arya, and this is my project Mentis.ai. Mentis.ai is a program that can improve your well-being with deep insights about your mind with a neural network. So what Mentis.ai does is it asks questions to the user about their lifestyle practices and their genetics, and based on that, it makes predictions on if the user has a higher likelihood of developing dementia or a lower likelihood of getting dementia. Um, Also, later, there is another program with lots of graphs that show the relationship between different factors, like different lifestyle factors, different genetic factors, and dementia. And that's supposed to kind of help spread awareness to the user so that the user can kind of learn about their own personal risk for dementia and the different ways that they might combat that and slow the progression of dementia. Um, so for the demo, um, first, when I run the code, it takes a few seconds to load. So the first question is, do you have the presence of the APOE4 gene? If you aren't sure, just press 1. So just as an example, I'll just say negative. And then it asks, what is your smoking status? Um, and it asks, some more questions. Do you have any chronic health conditions? What's your highest level of education? Um, what is your cognitive test score? I'll just, yeah. So then the neural network using another data set will train itself, and then using the answers that I gave to these questions, it will predict that there is a higher likelihood that I will have dementia. Um, and then after that, there's another program that, like I said, visualizes data. So first it kind of focuses on like mental health and different factors about mental health. So the first one is physical activity, and it looks at all these different people who are more active and the amount of people that have dementia and the people that are less active and the amount of those people that have dementia. It also looks at sleep, and how that relates to dementia. It looks at alcohol levels. And so these are trying to show the connection between someone's mental health and dementia. So the user can look at these and sort of learn about what factors might influence dementia. The next thing was like genetic factors. So this is like sex, so like male versus female, and how that relates to dementia. Then I also have family histories, um, and the APOE4 gene. Um, so the next thing was finding the factors that are most influential on dementia. So that was the next few things I visualized. So the factor with the largest influence in the data set was this gene. As you can see, there's a lot of people that are positive that have dementia. And then the next one was smoking habits was influential, probably because no one that currently smokes has dementia in this data set. And then it shows the chronic health conditions to also be influential because a lot of people with diabetes have dementia. And also the education level was influential, and the cognitive test scores were also influential. So these are basically just to educate the user on different lifestyle factors and genetic factors so that they have a better idea of what can cause dementia and how they can make changes in their life to um, stop dementia, or not stop dementia, but sort of, you know, stop the progress of dementia, so that even when someone's younger, they can take steps at that age to like um, slow the progression of dementia when they're older. If I were to improve this, I would probably do a UI for the predictions because I think that would just improve the user experience. I also would want to ask a lot like more questions because I only have um 5 questions here, and I think to ask more would help gain more information about the patient. Um, but yeah, that's my project. Thank you for watching.